Hello, my name is Dr. Sam Greenblatt, and I am a clinician who specializes in the treatment of anxiety disorders such as OCD. And I wanted to talk to you today about how to best manage your OCD during the coronavirus pandemic. So, I want to start with something that I learned even though I've been specializing in OCD for a number of years. This was a surprising thing to learn, which I would not have learned unless the coronavirus pandemic really blossomed. I would have hypothesized that the OCD population would have responded to the coronavirus at large by starting to obsess and compulse about the coronavirus itself. However, I haven't found this generally to be the case, although some individuals have responded to the pandemic by spiking about the pandemic a little more. In general, what I've experienced is that OCD is pretty stereotyped, and even though the coronavirus has increased the anxiety levels of the general population, the way that I've experienced the OCD population responding to the coronavirus has just been an increase of symptoms about their own pre-existing spike themes, their own pre-existing obsessional themes. So, for example, if somebody has HOCD and fears of being gay, or fears that their determination of their sexuality is an incorrect determination, they've responded to the coronavirus not by adopting a fear of the coronavirus and washing their hands compulsively, but just by experiencing kind of an increased intensity or frequency of the intrusive thoughts related to the HOCD. So, I want to provide some guidelines, especially as the US policies evolve and it's becoming more and more likely that individuals are working from home or going to be experiencing some sort of quarantine. I wanted to provide a few guidelines so that individuals with OCD could structure their lives as effectively as possible to help continue to manage their symptoms. Now, of course, any advice that I give, take it with kind of a grain of salt of how it would apply to you, and I encourage each person to work with their own individual therapist in order to best treat their symptoms. But these are some general guidelines that I think could be helpful for a wide array of individuals. So, if you are working at home, the first thing that I think would be incredibly important is some sort of schedule. We could sometimes see, freedom or kind of vacation time as a gift, but I often find that OCD is kind of like a gas where it's going to expand to fill whatever volume you provide it. So if you're giving it a lot of free time, it's going to take that free time, and it's going to be a lot more difficult with a lack of structure for you to resist the urge to obsess or compulse. So writing out a set structure of when you're going to be working, when you're going to be engaged in some free time, and what you're going to be doing with that free time. Even if you have to have it detailed hour by hour, could be a really useful way of making sure that you're not having hours of unchecked time for the OCD to wander. Now, in terms of what's most useful to schedule in that time, there are a few things that the evidence base shows are really useful for mental health. If you're working with an individual therapist or you have your exposures already kind of planned out, keeping up with your exposure practice would be kind of an essential part of any OCD treatment. What I would also recommend implementing on a daily basis would be at least 10 to 20 minutes of mindfulness practice. There's a number of guides online or apps like Headspace or Calm, and mindfulness meditation has been shown through years and years of evidence to really help us achieve some sort of separation, distance, observing self, or metacognition, whatever phrase you want to use to describe it, but helps us have some distance between our relationship of us as the individual making decisions in our autonomous selves, and the intrusive thoughts or independent systems that is controlled by the OCD. Practicing that mindfulness, that would be focusing on something in the present moment, noticing when your mind inevitably wanders, and gently bring your attention back to the breath or whatever you're focusing on in the present moment, is a skill that could help you in your day-to-day life when you're experiencing some obsessional thoughts, noticing that your mind is wandering to those obsessions and gently bringing them back to something in the present moment. So it's really a skill that could be one-to-one applied to when you're struggling with your OCD. The other thing that I'd really recommend is some sort of exercise. Granted, we might have some limited space in a potential quarantine, but you could always do jumping jacks or running in place. But some sort of exercise that could keep your heart rate up for at least 20 minutes. There's ample evidence that shows that the effects of having that heart rate up for at least 20 minutes, at least 3 times a week, but if you have a lot of free time, why not every day in the coming days, can have as great of an effect on reducing levels of anxiety or depression as medication. So I would absolutely schedule that into your daily structure. Lastly, in terms of what to schedule into your free time, in addition to if you are working from home, would be a good balance of things that you would rate highly in terms of how much pleasure or enjoyment you would get out of that activity, and how much mastery or sense of accomplishment you would get out of that activity as well. So I urge you to really think and consider, you could even rate them on a scale from 1 to 10, which activities truly give you a high sense of pleasure and a high sense of mastery, a high sense of accomplishment. Because a lot of times people default to the things that they just feel like would numb them the most, like watching TV or browsing the internet on their phone. But if you're creative enough, you might be able to find things, practicing an instrument, learning a new language, studying kind of a new material that could really help provide some value to your day. So when you go to sleep at night, you're not looking back on your day thinking, oh, another day kind of wasted at home in isolation, but you can continue to provide yourself with things that give you a sense of value and a sense of meaning in life. Lastly, what I'll state is that if you do have OCD that is kind of capitalizing on the specific themes of pandemic and COVID-19, what I would recommend is following the CDC or WHO guidelines. Sometimes they're updated, and, you could check every now and then if they are. But following those and being mindful of whether the cleaning that you're doing or the decontaminating, quote unquote, that you're doing is adherent with those guidelines or goes far above and beyond and is more about compulsively trying to achieve some sense of certainty or control over the situation. And of course, in any OCD or anxiety work, accepting some uncertainty is inherent. So of course, I'm not advocating anybody putting themselves in any situation that would be any great risk. Now's not the time to do contamination exposures of going into the subway and licking the handles. But adhering to the expert opinion, whatever that might be at the given moment, and mindfully kind of understanding where the boundaries lie between the expert opinion and where your OCD might take over is something that I encourage you to think about. So I hope that these suggestions are helpful to you. If you want any further help, I could always be contacted for individual sessions at the information on the screen that you can see right now. And I wish you the best luck in your mental health journey.